All right, the Arkansas Department of Health has been working 24/7 trying to keep Arkansans as safe as possible. Infectious disease specialist Dr. Jennifer Dillahay joins us now to discuss what all is being done. Thanks so much for joining us this morning.
I'm glad to be here.
All right, so first of all, we're sitting a distance apart.
Yes.
So I do want to talk about social distancing. I know a lot of people are saying, is this going overboard? Is this actually helping? What can you tell people about social distancing?
Well, I think social distancing is important, and it means staying about 6 feet away from another person. But it's more than that. It's not going out in public when you don't need to. It's about going to the store less often so that you can combine your trips. You know, instead of going to the grocery store twice a week, you might go once a week.
Okay.
And it's also about not touching other people. So, you know, we like to shake hands or give hugs, and those are hard habits to break.
Yeah.
But I think that they are important habits to change. So we can give a little bow or we can tap another person's foot. But really, we want to stay without having contact, if at all possible.
Okay. And so yesterday, the Department of Health announced or confirmed that the cases nearly doubled. Should people be concerned at all that we are seeing more cases here in Arkansas?
Well, I think as testing is more widely available, we'll see more and more cases, and we're also seeing more transmission. So this is important for people to be aware of. This disease is very contagious. It's easy to transmit it within the community, and that's why things like social distancing, staying home when you're ill, if you are ill, calling your doctor in advance so that if you need to go to see your doctor, or if you become so ill that you need to go to the emergency room, that they know you're coming and they're ready. Whenever you enter any healthcare facility, you should have a mask on, and that prevents possible spread to the people working there. They're at very high risk for getting this disease.
Yeah, and so I know that some states, you know, like California, have implemented the whole statewide lockdown. Do you think that, could you see something like that happening here in Arkansas, or is that something that you think would be necessary?
I don't know if that will happen in Arkansas, but I think it's worth planning for the worst case scenario. You know, it's like plan for the worst, hope for the best. And I think it's important too for people to take steps to take care of themselves. Good hand hygiene is so important.
And yesterday we did learn that, you know, the 62 confirmed cases here in Arkansas, 41 are people between the ages of 19 and 64. We had been hearing, you know, this was more of a virus that the elderly get. So what do these numbers show now that, you know, younger people are getting it?
No, this virus anyone can get. It's those who are older, the 65 and older group, that when they get the virus, they're more likely to have more serious disease. Younger people can have serious disease too, but it's more common in the 65 and older. Plus, it's can be very serious in people who have chronic health conditions of any age. So people who have heart disease or have had stroke. It could be people who have diabetes or lung disease. Those people would be at increased risk for having severe disease if they get it.
Okay. All right. Well, thank you so much for joining us this morning.
I'm glad to be here.
All right.